Lawmakers in Washington continue to argue over what details should be included in the health care reform bill.
But for many people, the personal stories behind health care reform are what drive the debate. News Channel 8's Mark McPherson joins us now live with part 2 of our special series, Getting to the Heart of Health Care.
Well, much of the health care debate centers around getting coverage for the uninsured. But what about people who have insurance, who've had it their entire lives, but only when they face a costly diagnosis do they see it disappear? Well, tonight you'll hear from a man who had stage 4 cancer, whose fear of dying is matched only with the fear his health insurance company won't help him live.
Oh!
Dave Wester has an infectious laugh that's hard to ignore.
It was fun to see the looks on people's faces.
The 62-year-old says it's gotten him through some tough times.
I guess the psychologist would call that a coping mechanism, I guess.
He was going to have to rely on that coping mechanism when his life changed forever in 2003. That summer, he noticed he was getting a little more tired on his runs than usual.
But I just thought, well, I'm getting older. You know, this is what's happening.
Dave went in for a routine physical when the doctor noticed something wrong. It wasn't long before he got the news no one wants to hear.
He says, I'm going to tell you something, and I don't want this to shock you. He says, you have leukemia, but the kind of leukemia that you have, we can treat that.
What he had was chronic lymphocytic leukemia, stage 4. The doctors did say that Dave could fight it, and it was something the then 56-year-old was ready for. But after 2 rounds of chemo, followed by 2 relapses, the doctor said it was time for something more.
We might be able to get you into a remission a 3rd time, but it would be very short. This is your only hope now is to go in for the transplant.
The transplant was dangerous, but Wester knew he would not live without it. The procedure was also costly, but that didn't worry Wester because it was specifically covered by his insurance plan. Or so he thought.
I'll have to tell you, though, emotionally, the 2 hardest times for me were a couple of days after the diagnosis when it hit me, and then this spring when I got the letter from the insurance company.
Even though the procedure appeared to be covered by his plan, his carrier was denying the transplant.
All of a sudden you get this letter. They don't call, it's just a cold, hard letter, comes in the mail, about 2 sentences, says we have decided not to cover this. They don't even tell you why.
So just like he did after his first diagnosis 6 years earlier, Wester's fight started again.
How complicated did it get when you were starting to track this down, when you got into the...
It's tricky as hell. Here.
Dave's first appeal was denied. He turned to state lawmakers for help, but finally found a ray of hope with the federal government. Now, because Wester had been a federal employee, the U.S. Office of Personnel Management leaned on his insurance company to greenlight Dave's treatment. It wasn't long before he received another letter.
Now, keep in mind they had very coldly denied the coverage the first time, and then they denied the appeal in just the same kind of cold language. Now they get directed by the Office of Personnel Management to provide the coverage. The next letter I get starts out with these words. After careful consideration, we have decided...
Dave would get his transplant. It was a close call, one he says is all too common.
All you got to do is walk into a cancer support where people are having expensive treatments, and you'll get all the stories you want.
He thought his story was important enough to share at the town hall meeting in Richland Center.
I am wholeheartedly in favor of the public option.
And while laughter has always been how Dave copes, on this day, there were tears.
Just imagine when you're in that situation, when you're dealing with end-of-life issues, and your insurance company does that to you, you can see it still affects. That was not just blowing smoke, and there's a lot of people that do blow smoke at these meetings, and I had something that had actually happened. This was not talking about the fear of what was in the proposal or something. This is what had happened, and I really wanted to get that into the mix.
Now, it should be mentioned that Dave asked us not to mention the name of his insurance company because even though he received his treatment, he was still afraid after what he had been through that they might change their mind on future treatment. That's why we also blurred out the names in the letters that we got. And to this day, he still has not gotten an explanation from his insurance company why he was denied the first 2 times.
I got to say, obviously, these personal stories are very compelling, but also people really want to know kind of the cold, hard facts about what all this health care change is about.
Yeah, that's absolutely right. Whether the public option is going to be and how much it's it's going to cost, what it's going to mean for them if they have to take the public option, if it's there. And in the next couple installments of Getting to the Heart of Healthcare, we're going to try to answer those questions. We're going to talk to experts and really get to the heart of what this means for them.
All right. Very interesting. Thanks, Mark. Our special series, Getting to the Heart of Healthcare, runs all this week on News Channel 8 at 10 and again on News Channel 8 this morning. Now, if you miss any of the stories, you can always find them on our website, WKBT.com.